I'm so excited to be presenting again today. And as you see on the slide, there's a little bit about me, which you certainly can read. But I thought I'd add something to this slide, and that is that I've had the great experience of teaching in probably the second concept-based curriculum that exists, and that was at the University of Maryland in the 80s. So we think that today we're having our first experience with a concept-based curriculum, but in fact, there was an attempt in the early 80s to go concept-based in nursing. Wasn't terribly successful, mostly because we didn't know a lot about it and we didn't really have any faculty development. So just as a reminder, and I've said this in earlier webinars, that if you are going to a concept-based curriculum, if you are currently teaching in a concept-based curriculum, or you're planning on revising your concept-based curriculum, faculty development is just a really important piece, and that's why we're trying to provide these series of seminars, webinars for all of you. I've been consulting in modern day concept-based curriculum for about 12 years. I'm doing CBC conferences, so much of what I'm going to share with you is from my own experience, what I've seen nationally and internationally. Some of you may be from Canada. Canada has also joined the concept-based movement, and they are moving quite quickly into to this new revolution, if you will. So on the next slide, I'll begin talking about our focus for today, which is just a few tips and tools. And of course, in a half an hour, I can't very well go through every possible tip and tool, but I've selected some for conceptual teaching and learning in the classroom, and perhaps even online. So we're focusing on the didactic part of the concept-based curriculum. In a future webinar, we will be doing some information, some content related to clinical experiences in the clinical learning environment. Just to start, before I talk about introducing nursing concepts, I'm sure you all know this, that lecture, traditional lecture, and PowerPoints are not the major teaching learning modalities in a concept-based curriculum. Even though I know your students may ask for it, PowerPoints, somehow just don't make a point. There tend to be hundreds of them oftentimes for a class. So that's really not meeting today's learner. So the first thing I want to talk about is introducing nursing concepts, because they are always introduced in a classroom or online environment. They're not usually introduced in a clinical environment. So when we're talking about introducing concepts, we want a presentation that highlights the most important content using a very consistent template. Now, some people have used and by the way, you can go to handout number 1 because we are going to be going through that in just a minute. So as I look at a template such as handout number 1, I think it helps the students really get familiar with what the concept is. And this is important. Some people do use textbooks for that purpose. Of course, there's several out there. But I would just say that sometimes it's more than what the student needs, depending on what type of program you're in. So this is a nice synopsis, a concept analysis, if you will, of various kinds of concepts. And as you know, the template's going to vary a little differently depending on the type of concept. So handout 1 is a health concept. Some people call it a health and illness concept. That's up to you what you want to use for terminology. But this just shows, and this is actually from a program on perfusion. And so I want to walk you through the pieces of this handout template so that you'll be familiar with each piece. I think it's important that when you decide on whatever format you're going to use, that you're consistent across all of your health concepts. That's going to be important for the student. So the first thing is definition. And you can get those definitions from a variety of places. Sometimes I'll go to one source, but most of the time I have a definition, or I use definitions that are an amalgamation of the current literature. Sometimes it's research, sometimes it's just consensus definitions. So the student understands what we're talking about when we say perfusion. And all faculty will know this too. So students get a copy of this template, of this presentation, this introduction, if you will. Some people call it a concept analysis. And then also faculty will all have the same information. So no matter where I teach as a faculty member, and I'm talking about perfusion, I'll be able to refer to this document. And students will be held accountable for going back and reviewing this basic introduction when later we talk about exemplars like stroke or shock. Then the next piece you see on the template is scope of perfusion, or you might even say categories, depending on the nature. Perfusion works really well on a continuum where we can put normal perfusion on one end and perhaps totally inadequate perfusion on the other. And sometimes for my visual learners, I do continue, I draw an arrow, I draw a line so that they can see where people would fall on that continuum. Then the next section is either risk factors or populations at risk. I tend to use both of them. So who's at risk for impairment of the health concept? It could be impaired elimination, it could be, or an altered elimination, it could be impairment in nutrition, whatever your concepts are that you select. Remember, your faculty select the concepts that make the most sense. And as you see, I've just listed the modifiable, or they just listed the modifiable and non-modifiable factors. I sort of like the bulleted, when you can bullet content. This one isn't as bulleted as some that I've seen, but I really like the bulleted approach because it's easy to retrieve the information for sure. The next topic, as you see, are the physiologic consequences of impaired, whatever that concept would be. Sometimes we add psychological or psychosocial consequences. So, for example, if we're talking about cognition, there certainly are psychosocial consequences as well as physiologic consequences of impaired cognition. So again, you can use whichever one makes sense to you and you think your students would understand. The next is, how would you know if you look at a patient or a client? I'm not going to get hung up on that terminology today. How would you know what an individual's perfusion status was? What were the things the nurse would look for? Again, you could do a bulleted list. This is more narrative, but you could easily go into a bulleted list. Sometimes in this section, I find that some faculty get a little carried away because they want to teach everything about perfusion, so they're listing a whole litany of diagnostic tests, lab tests, and so forth, and that really is not necessary here. If you want to list one or two, that's fine, but this isn't a place to teach everything about perfusion. It is a place for them to understand the concept of perfusion. The next topic is health promotion strategies, or if you wanted to write it, nursing interventions to promote health, that would be fine. We want to prevent an individual from having an impairment of that concept. So what are some things that you might want to do to make sure that those health promotion strategies exist? And then nursing interventions for patients who actually have an impairment. What would that look like? What would that look like in terms of just observation or any other type of interventions I'd want to do for any type of perfusion impairment, whether it's severe impairment or mild impairment. The last topic that I've listed here are interrelated concepts. And interrelated concepts, just pick a few. I see people, again, write 10, 12. After a while, it becomes very circular if we're listing too many. So I would just suggest select just maybe 2 or 3 max of the most important interrelated concepts. And certainly for perfusion, oxygenation, and gas exchange, some people combine those, some people make those separate. You can certainly make that decision. One other topic that you could also add, as you see on this slide that we're looking at now, is that it's optional to add a topic entitled Exemplars included in the curriculum. I really like doing that, to just write exemplars included in the curriculum so that the student sort of has an advanced organizer, like this is just the beginning of perfusion, but later we're going to talk about stroke, we're going to talk about shock, we're going to talk about anemia, whatever those things might be. So I think that's important. Very important point is that faculty need to decide when the introduction is going to occur. And you don't want to introduce every concept in the very first course, or the students will be totally overwhelmed. So you want to make the decision about which concepts do they really need to introduce when, because you can't talk about any exemplars, or you should not, unless you do an introduction. The introduction is only visited once, but obviously the concept is going to be visited more than once. So what about the template for, on the next slide, for professional nursing? Because that is, those are very soft concepts, things like law and ethics, whatever you might have under your professional nursing concepts. You might have clinical judgment, whatever those concepts might be. You do a very similar template, just the way I've set up the one for perfusion, but you're certainly going to start with a definition. You're going to have the categories of scope, or categories or scope, as we did on the other one. Attributes with theoretical links. So this is where we differ now, because these are soft concepts, and we are not really assessing or taking care of an individual. This is the nurse. This is who the nurse is. So it's the nurse who follows legal ethical standards and uses clinical judgment. So what are the attributes of that concept? On the next slide, you'll see the remainder of the pieces for the template. That is, what are some examples of using the concept in nursing and healthcare? You don't have to use the word context if you think that's bulky or cumbersome for students. You can just say examples of how the concept is used in nursing and healthcare. And I actually have an example, by the way, of a soft concept in my ConceptBased book, which I have referred to at the bottom. Interrelated concepts would also be important for these professional nursing concepts, as well as the optional, you can add exemplars in this curriculum. So on the next slide, we're going to start talking a little bit about lesson plans, because your second handout on this next slide we'll be talking about, and I gave you one that talks about, hang on one second here. Okay, so I gave you one on cognition. I didn't give you another one on perfusion. I thought this would be fine. So we want to use this lesson plan, very important to use for both concept introductions and for the exemplars. So some people call this a student study guide. You certainly can call it that, but this is the document that really tells the student and faculty, here's what we're talking about. So this particular lesson plan, the students have already had the concept introduction of cognition, and now we're moving on to talk about Alzheimer's disease, which is, of course, the exemplar. So I gave them, so this is one of my favorite activities to do with faculty, because, and you can certainly tweak it to meet your needs and what faculty like, but I really like the division under learning activities and assessment, and that would be formative assessment, to divide the information up into before class, during class, and after class, because it tells the student before class, you're an adult learner, you are accountable for doing certain things. And one of those things are going to be not only review the anatomy and physiology related to the concept, which in this case is the brain. In particular, cognition would be a focus on the frontal lobe and the lobes of the brain, but also to look at the worksheet, or do a worksheet that refreshes the student on cognition as an introduction. And I might ask them certain questions. They can maybe bring it to class as a minute ticket. It might be an online quiz before class, however you set that up. But you're not going to spend time when you start talking about Alzheimer's disease as an exemplar and you present it through the lens of the concept. You're going to want students to know what that concept is. So that's what this lesson plan is all about. You'll also notice that the reading is on here, and this particular program happened to use my MedSearch book, so that's why it says Iggy. That wasn't me trying to promote myself. If you go on to number 3 through 10, those student learning outcomes, and which is the most important content in any lesson plan or student study guide, are those student learning outcomes related to the content. What are my expectations from my students, so that they'll know what they're accountable for and what we want them to achieve, but also it tells me and it tells faculty, it keeps us accountable to make sure we focus on those areas. The way those SLOs are worded are certainly going to help you as a faculty member determine the teaching learning activities we're going to use. So on the next slide, just sort of summarizes just the need to delineate student expectations before class, during class, and after class. If you were teaching a course completely or partially online, obviously you would want to adapt some of the learning activities because online learning is a little different and some of the assessments are different, but the expectations are equally essential for sure. So let's talk now about a few active learning strategies to promote classroom conceptual learning. And keep in mind that your SLOs are going to drive this active learning. I made a comment on this slide that says active learning does not require a flipped classroom, but a flipped classroom requires active learning. I sometimes will hear consultants say or speakers say that, a flipped classroom is a concept-based classroom. Not necessarily. And so I think more importantly, is your classroom active? Are the students active? Are they engaged? Are they getting up out of their chairs? Are they in groups? Are they moving? Are they talking? I should be able to walk into an active classroom and delineate that it is active versus passive. Another term I like instead of flipped classroom, I like the term scrambled classroom. Because scrambled classroom means that I'm going to have active learning periods, but I'm also going to debrief. Debriefing isn't just for simulation. Debriefing is when I'm going to clarify and I'm going to highlight, summarize, I'm going to prioritize for the students, and I might even update. So for example, if we do a case study, I'm going to bring everybody back. I'm going to go over the most important points after what they've told me, what they came up with, and I'm going to really help them hone in on the most important. Again, all learning activities are directed by those content flows, those content student learning outcomes, and they are tailored to student learning preferences. So we want to be using a variety of activities. So the next slide will talk about what some of those might be. So first of all, we're going to talk about pair discussions. I find that a lot of students hate groups. As soon as you say groups, they just freak out. But a group is two or more, and I find even the individual learner, the learner who hates groups, really can do okay with a pair. So pair discussions, pair projects, pair activities are very good, and there are quite a few in the literature. I'm sure all of you have used Think, Pair, Share. Sometimes we almost overuse a Think, Pair, Share, but if you've never used that, essentially you throw out a question to the group. Each person in a designated pair thinks about the answer, writes down his or her own answer, and then they compare their answers. You always, in any activity, want to time the activity. Because if you're not careful and you're not walking around the room, or of course online it's a little bit more difficult, but if you're not walking around the room and making sure that they're on point, they may digress and talk about other things that aren't related to what point you're trying to have them discuss. Let's discuss could just be a question you throw out to the whole group. And a lot of times when I use let's discuss, let's say I'm presenting the concept of stress and coping. Well, I don't have to tell nursing students what stress is. I don't have to tell them how to cope because many of them are using effective and perhaps ineffective coping strategies. So let's discuss that. What are some effective coping strategies that you find are useful to you in this nursing program? So I think these are adults who have a lot of work and life experience oftentimes, and they may not. You may have a more traditional student depending on what setting you're in, what type of program you're in. But it's important that we pull from the students their experiences because we know that a major tenet of adult learning is to connect new information with the content that they already know or their experiences they already know. Socratic questioning, there's actually some apps you can Google. There's some great free apps that help with Socratic questioning. This supports what Dr. Benner has talked about for 8 or 9 years now, where she talks about creating during the didactic portion, during the theory or online classroom portion of your learning environment, your learning experiences, you create for the student clinical imagination. So if you're talking about an ethical dilemma, if you're talking about someone who has a stroke, if you're talking about a person who has schizophrenia, or anything you're talking about, create that clinical imagination, the what if questions. What would you do if? What else? How does that relate? How does A relate to B? Those questions are very, very good. And there are a number of great sources where there's lists of those that you can use. I think a lot of us use them in clinical settings when we're with students, but I'm not so sure we use it as effectively in the classroom. And it's something that I would encourage you to do. Structured controversy is also a pair activity where students share their pro and con views of an ethical dilemma. And they do that in pairs, and everybody's talking at one time, which is fine because it really makes them explore. When you have a student look at both a pro and a con side, they have to delve deeply and they have to really think. So it's a great activity, and I do discuss that in my book. And then, of course, the next slide shows probably the one and most important or commonly used particular activity, and that is case studies. And case studies there's all sorts of case studies. There's some good ones, there's some that are not good. Let me just say that some case studies aren't very thinking oriented. We don't want them to answer knowledge questions in a case study. So case studies can be single or an episodic one-time event or unfolding over time. I really have to say personally, I've enjoyed the unfolding because students often, when they are in a clinical setting, they only see one point in time. They don't see where the person comes from and where they're going. So unfolding case studies are just 2 or 3 phases or episodes. It can be over minutes or hours, days, weeks, whatever you would like to structure for the purpose that you're using it. I also want to say to those of you who teach in a pre-licensure program that you really want to be sure your case studies focus on clinical judgment. And there's a lot of information coming out now about the new National Council of State Boards of Nursing clinical judgment model. And if you've not seen that model, if you're not familiar with that model, it's a 6-step model that's replacing the nursing process. It's built on clinical reasoning and critical thinking and decision making as the process. The outcome is a clinical judgment. And I would encourage you to look at that and start having your students organize their thinking once they've learned the nursing process later in the program, have them go forward into clinical judgment. So what are some things on the next slide that we want our case studies to look like? We want them to be relevant. Really, this is really true for all learning activities, but in particular case studies, I find sometimes they're not very relevant. And that is a word, by the way, being used a lot in the clinical judgment model. It's relevance. Be realistic, be engaging, be challenging, and be instructional. And I'd say all active learning activities should meet these criteria, but especially your case studies, I sometimes find they're not so much. So we also use graphic organizers or pictures. On this next slide, you'll see the Venn diagram, and you may be used to this structure. I'm not sure if you've used this, but this is an example of a graphic organizer. A graphic organizer is simply content put into a picture, and there's a number of types of them. But my 2 favorite are the Venn diagram, and later I'll mention something about concept mapping. So this is a great activity that students can do in class rather than you give them the Venn diagram already completed. Have them look at, compare, and contrast 2 major topics, subtopics, or concepts. So think for a moment, what could you use? Could you, if you teach pharm, could you use it to compare and contrast how 2 groups of drugs, 2 drug classes work? What are the nursing actions and nursing implications? You could use it for patho, looking at pathologic processes, or you could also use it for signs and symptoms. You could use it for nursing assessment. Signs and symptoms lead me to nursing assessment. So if I'm comparing rheumatoid arthritis, what folks look like with rheumatoid disease versus osteoarthritis, what do they have in common? That would be the overlapping area of joint pain and stiffness, but how are they also very different? I could look at sets of nursing interventions, and the list goes on and on. The idea is this compare and contrast activity stimulates thinking and conceptual learning. And any time that you can have students compare and contrast, that is definitely you're on the right path to thinking and conceptual learning. Another type on the next slide are concept maps, and I'm sure you've learned and used concept maps for a while. My favorite concept maps are those that are not pre-structured. I do know that there are some folks presenting a structure where they take a form and there's boxes and arrows and lines, but it really, I find they take the care plan, they just chop it up and they put it into these boxes. If you give the students a blank canvas, give them some guidance and direction and show them some examples, they then create the connections and determine relationships. Most of us use concept maps for the clinical arena, but I'm here to tell you that they're very effective online, they're very effective being used in the classroom, and they are very effective for students to dig deeper about concepts or exemplars. It shows relationships, and that's the most important piece. It's not just a lot of information scattered about on a page, but this piece causes this, and this is the result of that, and it really, they have to literally state what that relationship is. They can be very simple, like the one on the next slide, or they can be more complex. So this next slide shows a very, very simple one. So this is mobility in the middle, which is my primary concept I want the student to learn. And then they can come up with, or I could present this on a slide. Why would sensory perception be an interrelated concept for mobility? Why would perfusion? And you may not agree that all these are relative, but they are some of the ones in the literature. So certainly I would probably pick just one or two maybe to focus on, but this would show a whole array. If they could come up with examples, that would be great. You also notice it's color, and I love color. I think that the students can be told, you know, what colors and shapes, or we can let them create their own legend. Anyway, however you use it, it is conceptual learning. These replace, well, not this particular one, but concept mapping, particularly when you're focused on a situated learning or you're focused on a case scenario or an actual patient. These are replacing the traditional nursing care plan because that's not as useful because it's more linear. This is messy. This can get very messy, but it does contribute to thinking, requires thinking and conceptual learning. On the next slide, we'll see a couple of other strategies, and you probably use many of these. But storytelling, as a matter of fact, I just saw somebody doing a webinar on storytelling as an ancient modality. Storytelling is one of those things that has been going on for centuries. I lived in New Mexico for 14 years, and storytelling is very powerful with the Native American, American Indian groups. And the faculty can tell the story, the students can tell the story, but you want a purpose to it. So some of you might be familiar with a term called narrative pedagogy, and that's basically a story told by a student that relates to the content or the concept or the purpose for which we want that story told. Otherwise, people go on sometimes, and it's hard to rein them in. So you want your students to focus and really make it a learning opportunity in the story. You can also overdo stories. I've seen faculty just tell so many stories that the student really misses the point. So sometimes we want them to really look at that and think about and analyze that. Also, stories can be told with video. Doesn't have to be audio, can be video. Anytime you use a video, of course, you're going to want, when you're doing your story or you want to show a patient or patient behavior, you want a purpose. You want them to think about what should they be looking for, what are the concepts, what's going on in the situation. Test item checks, particularly in pre-licensure programs, and those of you preparing nurse practitioners as well, where you do practice questions that would help them for the licensure or the certifying exam. It's so important that they get practice with these. We know that these create thinking. I'm not talking about knowledge base now, I'm talking about thinking level, applying in higher level. Collaborative testing is another tool that folks are using. It's a great learning tool. So, excuse me, I'm not using it to replace the test and using it as a supplement or an adjunct to the test. So they take the test and then they do it together in pairs or groups. So even if you're doing testing on the computer, you certainly can do electronic pairs. They can sit at one computer and they can take the test again before they get their answers. So they take the test a second time immediately after the individual test. They go through it. They don't have the answers. They don't have access to resources. And then they discuss and think and process each question, each answer. And it's a great learning tool. I also found in my own experience that the students, when I went through the test and the results of what I wanted, the answers I had wanted, they were less likely to fuss with me because they had already fussed with each other and worked it all out. So test review was really crucial, in my opinion, and essential, but I don't want it to be a war or a battle. So that really helped with that situation. Send a problem is an example of an activity in which the students, this is preparation for the test or make sure they're learning as a formative assessment, where the students actually write test questions in groups and then they pass the questions around. But I usually give them a time frame so that they are not lingering. So once they have the test question done, they then pass it on to the next group, they answer it, and so forth. So that is so-called send a problem. Other people call it other things, but that's just something that I see frequently used. So on the next slide, a couple more activities. And I've already mentioned video, but I'm going to say that again, and audio learning aids. So important to do. Do keep your video short. If you're going to use it in class, you want to restrict it to 3 to 5 minutes. Some resources say 7 to 10. So I would say 10 is the outside. You don't want them watching a full-length feature in class, but certainly if you want them to do that, they can do that out of class before they come. Gaming is another activity that many people use. One thing that Dr. Benner said in her work of 2010 in her study report of the Carnegie Foundation, she said that gaming can be take up the whole class period. And we don't want to have 2 hours of Jeopardy. We want to have a specific use for it, again, a short time. And the biggest use of gaming, particularly things like Jeopardy and others that people have used, is that it's good for knowledge. It's good for knowledge, not as much for thinking activities. And then, of course, there's a whole host of internet resources and apps that our students, back in the day, we said no cell phone. Anybody today doesn't say that because we want them to use their mobile device, their handheld mobile devices, so that they can be involved in class. They can look things up together. We can all look up things together and use the apps that are available for audience response systems, etc. There's plenty of great tools out there. So I would encourage you to explore those. Again, being careful not to use a lot of them for knowledge, strictly knowledge, but as much for thinking as possible. Even though many of you have courses where there's brand new medical terminology. Once they have that, we need to get them to a thinking process. So I've done a lot of talking, so I've given you a few references on the next slide. And let me just go over a couple of these. Lynn Erickson is the person who is credited with K through 12 modern day conceptual teaching and learning. And her earlier books from 2002, she's put out a number of them. This one is really very nice, 2014 one, in which she co-wrote with Lanning to help faculty, help teachers transition to the concept-based model. It's just really hard for a lot of us to wrap our head around that. It's not the way we were taught. And you don't just wake up overnight saying, I'm going to teach conceptually when you've been teaching traditionally for a long time. So she gives you a lot of really good tips. Even though that she's a K through 12 person, I think there's some great tips in there. And then, of course, you're probably familiar with Giddens, Caputi, and Rogers. They're Mastering Concept-Based Teaching, a guide for nursing educators. That one, I would say probably about 2/3 of it really explains what concept-based curricula is all about. And then at the end, they have some of the templates I've mentioned when you introduce a concept, as well as a few activities for both the classroom, online, and then, of course, clinical. And then if you're looking for some creative teaching strategies that you can use in any curriculum at any time, in clinical and in classroom, and that would be the Creating Teaching Strategies, second edition, that Judy Herman put together. She's got some fun and timed, she always tells you the time that it takes, which I really, really like. And much of what I've talked about is in her book, but she has other quick and very quick tools that you can use. And then the book that I've referenced throughout, because most of you probably know me from my Med-Surg book, but I actually wrote, and it is out even though it says 2019, teaching a little small book with Jones and Bartlett, Teaching and Learning in a Concept-Based Curriculum, and it walks you through a how-to practice approach. So I will then turn this over to Jen, who's going to wrap up before we take questions. Thank you so much.
Excellent. Thanks so much, Donna. Great presentation, some great examples. I know we have a lot of faculty who are very interested in this. Donna has been kind enough to leave her contact information if anybody would like to reach out to her directly. Her email address as well as her mobile number are listed. And if you would like to purchase the text today, I encourage you to visit go.jblearning.com/cbnc. And we are offering 25% off of the price today. That's valid through the end of the year if you use the coupon code CBC25 at checkout, and that will also entitle you to free domestic shipping as well. And we encourage you to share the link to this webinar. It will be posted on our YouTube channel within about 24 hours or so. And everybody who has registered for this webinar, even if you didn't happen to attend the live version, if you have any colleagues who might be wondering how they can get access to the webinar, that will be posted shortly. I know we have a bunch of questions that came in, so we're going to transition into that Q&A. And I know that a few of you had messaged me directly saying that you had a little bit of a hard time finding where to access those handouts that Donna was referencing in the beginning of the presentation. I'll be sending out a link to those so you can reference those, and you'll also receive a PDF of today's slides as well. So I want to take a couple of questions. Give me just 1 second to get those ready. Okay, the first question, Donna, comes from Alicia. She's asking, how does concept-based education relate to NCLEX? Will it be helpful to students when they challenge the upcoming version of NCLEX that is rolling out in a couple of years?
So currently, as you probably know, the NCLEX has moved away from medical diagnoses, or focusing a lot on medical diagnosis. They've actually, when you look at the test plan, you'll see that there are very few diseases or disorders mentioned in the test plan, and in fact, they're very concept-based. So one purpose I see of concept-based is that it makes you reduce your content, so that when you're looking at exemplars, the exemplars are the most important diseases, disorders, or soft topics related to professional nursing. And that's what's on the NCLEX, not the remote, rare disorders, 49,000 different congenital or genetic disorders that you hardly ever see. It's going to be the major concerns that the nurse has and sees in practice today. I, too, went to those conferences. I just went to the Charlotte conference in September on the update on the NGN. Those of you in pre-licensure, you know what that means, the next generation of NCLEX. When I looked at the questions, they were major problems. Spinal cord injury, a woman in labor who's receiving oxytocin. That's not my area of expertise, but I know that's still pretty common. There were no rare problems presented. They were all major. I think they had a child who had a fracture. So they were major exemplars. So I think that the big focus is to really look at clinical judgment, because that is where the NGN is going. So if you have major exemplars organized by concepts and focus on clinical judgment, I think we will be preparing our students well for today and future NCLEX.
Thanks, Donna. We have another question that came in. Someone's just asking for some clarification. When you were referring to the first handout, Did you say that health promotion strategies in the handout number 1 is equal to nursing diagnosis?
Oh, no. I'm sorry if that's what, I don't think I said that, but let me just say health promotion strategies, that some faculty use health promotion strategies in that topic to prevent an impairment, or others use nursing interventions to promote health or prevent an impairment in the concept. So depending on how broad you want to be, health promotion could be perhaps some things that a person does individually without intervention from a nurse. So it depends on what it's basically health promotion is what that is. Whether you state it as health promotion strategies or you state it as nursing interventions to promote health or prevent impairment. I might add that nursing diagnosis NANDA per se, has never been tested on the NCLEX and will not be on the NGN. It will be analysis.
Thanks for making that distinction. I think that was very helpful. So here we have a bit of a longer question here, so I'm going to try to summarize it. Hold on one second. That just escaped me here. Okay, so this comes from Teresa, and she's saying that her and her team have implemented the concept-based curriculum. The second-year faculty are phasing in live now, and the first-year faculty have mostly presented the overall concept online as a PowerPoint. The students are expected to complete a prep guide of the exemplars before coming into class. And what this faculty person is seeing now in the second semester is that she may not use the prep guide as pre-class work. Instead, I may have readings assigned and in a class a larger unfolding case studies. The students are fine with the case studies, but they are very upset about not getting a prep guide. Do you have any suggestion? I feel certain concepts and exemplars work better with alternative active learning strategies. How do I handle the idea that the prep guide has become the gold standard?
I think if you're the faculty following what has happened the previous year, you're in a tough situation, because I don't see that typically there's a prep guide for students online. I don't see that typically. If you want to call the introductions a prep guide, that's fine, but then they need activities to make sure they learn each of the areas. For example, if I said assessment of perfusion, and I listed some ways to assess that, we need to have a learning activity so they would learn that information. So just doing it online, I think that's the problem with online learning in a traditional sense. A newer generation of online learning would say you don't just plop your PowerPoints and prep guide. I'm not saying that's what happened, but I sometimes see that people think they can take what they do in class and plop it online and call it online learning. But there's a whole field of online learning, and people can be certified in that area. So having said that, perhaps give them some quiz online that they can review, but in terms of presenting new information, I agree that something like an unfolding case study or other activities in class would be much, much richer for your exemplar. And Teresa, I'm more than willing to discuss that with you later if you want to email me if I didn't give you a satisfactory answer in a short time.
Thanks, Donna. Our next question comes from Catherine. What strategy is used to deter cheating with collaborative testing in relation to brain dumping?
I don't usually have a problem with cheating. I'm not really sure what the question is about. If they're not cheating because they haven't seen the answers to the test, and they are simply taking the test a second time immediately after they take it individually. So I don't have a problem with brain dumping. If they need to come in and write down everything they can think of, I don't have a problem with brain dumping. That's perfectly acceptable to do that. Because if you're asking your questions at a high enough level, you can dump all the brain you want, but you have to apply that knowledge and translate it into practice given the case scenario or the question. I'm not sure I can answer that question further without more information.
Okay. And another question from Teresa, how do we create concept-based exam questions?
So the main thing that you do for concept-based exam questions is only use the medical diagnosis if you need that exemplar to answer the question. So for example, if I'm asking a question about pain and pain is my concept, it doesn't matter what the pain is from, the acute pain is from. What do I need to know as a nurse about managing acute pain? I don't have to say it's because the patient fell off a roof and broke their neck or broke his neck or whatever. I don't have to say all of that. I just keep it simple. It's the client, the nurse who has acute pain. It's on this. It's at this intensity. It's located here. And then what's the nurse's priority action or priority additional assessment or whatever. So the way to do it is to keep exemplars out unless absolutely needed to answer the question. So for example, if I had a question about diabetic foot care, I'd have to say something about the patient being diabetic because it's a special care and that being a diabetic makes a difference. So only if it makes a difference. That's true for demographic data as well. You know, if it doesn't matter the child is 8 and the person can be of any age, there's no need to add it. However, I will tell you that looking at the NGN question, they're putting some of that demographic back in, which I found kind of interesting. So that is a confusion point right now, and I think that that will be resolved as they continue with their scoring exploration in their study.
Thanks, Donna. Another question from Melanie. She says she teaches in block theory, and all the theory for the course is taught up front over the course of 4 days or 24 hours. Students hardly have time to conduct the reading, so how do I incorporate these strategies? I'm concerned that they may miss important pieces of information.
Well, I would have to question teaching all the content in 24 hours, quite frankly, but the content is in their book. Right? They have a textbook and they have to read the content. So what we tend to do, I think, in traditional teaching, we tend to reorganize the content in the book, put it in PowerPoints or study guides, and then reteach it. So what the students have learned to do is that they don't read because they know that we're going to tell them what they need to know. So instead, they have to read, and then they bring the book to class or whatever you're doing online, whatever the activities are. And it's all activities, because if they haven't read, they will not be able to figure out a case study, or they'll be very slow at it. And if all of you agree that students are accountable for their own learning and we are accountable for facilitating it, then you should be fine doing the 24 hours. Although I think that's a killer. I would rather do 24 hours of active learning than 24 hours of a lecture. So the key, I think, is reading before class. I think that's the key.
Great. One last question. Again, just encouraging anyone who may have any additional thoughts or questions, you can message them to me, the organizer, directly. Donna, could you please define what an exemplar is? And also, I'm going to just put the second question in here. Can medical concepts be transferred over to and used for nursing-based concept curriculums?
Well, the first question I understood, the second one not so much. So exemplars are simply examples that if you learn that example well, then you could deal with any other example related to the concept. So for example, we teach pharmacology that way. We don't teach every drug that exists. We teach by major classification, which I'm going to call a concept, if you will, for lack of a better word. And then under each classification, we pick 1 or 2 or 3 prototypes, major, commonly used, commonly seen. If you know this, you would know any statin. If you know this, you'd know any beta blocker. If you know this, you would know. So it's the same idea, that we're going to pick concepts to help us organize the content. We're going to, for a health and illness concepts, we're going to use health problems or disorders or issues under each of those. Those are your exemplars. So I might only pick out of, I'm just guessing, 20 neurodegenerative disorders. I may only pick 2 or 3 that if they know those well, because we're focusing on the concept with the exemplar, not the patho with the exemplar, then I'm going to be able, because they've had patho, and if they haven't, if they understand the patho of all neurodegenerative disorders is very similar. at least in terms of nursing care, the implications for nursing care. So that's what an exemplar is. Now, in terms of the medical concepts, I wasn't quite sure what that meant, but if we're talking about signs and symptoms, I like to use the normal healthy. So I like to use oxygenation or gas exchange rather than dyspnea. So we have the healthy, and then under gas exchange might be COPD, or oxygenation might be COPD, asthma, might pick out the biggies across the lifespan, if that's how you teach, which is very commonly done today. But I wouldn't have to talk about every respiratory disorder that exists. So yes, medical diseases do become exemplars for health and illness concepts, but not for professional nursing or healthcare recipient concepts. Those are the softer, for lack of a better word, but equally important concepts of ethics and safety and clinical judgment and teamwork and collaboration and all the Houston competencies that we talk about. For either, let me just add that for all these things we're talking about in the questions and answers, I just want to point out that the learning activities that I've mentioned today and others replace lecture. So you'll have time to put together exemplars. For example, it's very seldom that we have a patient come in with one problem. They have multiple comorbidities, right? Whether they're in the clinic or they're in a nursing home or they're in acute care, ICU, wherever. They have multiple comorbidities and they have psychosocial problems. So you could pull all that together in an unfolding case study and do a phenomenal job in helping the students make sense of it all.
Great. Thank you so much, Donna. I think we answered some great questions, and we don't have any other questions to address from the faculty today. I do just want to remind everyone that we will be sending you the follow-up handouts, also a link to today's PowerPoint presentation, and we do encourage you, if you would like a copy of the textbook, to take advantage of the 25% off offer, and to be sure to share this webinar when it's available on our YouTube channel with your colleagues. And I want to extend a very warm big thank you to Donna Ignatavicius for spending some time with us today and for giving us some really great tips and strategies. Thank you, Donna.
You're welcome. Thank you. Have a good day, everybody.
Okay, great. Bye-bye.